Hi everyone, welcome back to The Support Bear, a podcast made to spread awareness about different mental health issues.
This time we're going to be talking about mood disorders.
Mood disorders are a group of mental illnesses where your general emotional state is inconsistent and can affect how you feel and think about yourself, other people, and life in general. Although there are a variety of different subtypes, the main ones we will talk about are major depressive disorder, bipolar disorder, and mania.
There is also major depressive disorders. It is characterized by an overall depressed mood. Dysthymic is a lesser form of major depression, and it is likely to be experienced through feelings of apathy, general unhappiness, and a loss of interest in the things that you used to enjoy before, and as well as mood swings. Many will also experience suicidal thoughts, have problems sleeping, feel excessively irritable, and socially isolated and restless.
People experiencing mania would usually experience elevated moods, unusually high energy levels, as well as feelings of euphoria. These moods typically last for 3 days or more and would last for most of the day. Symptoms of mania can include talking rapidly or excessively, needing significantly less sleep than usual, distractibility, poor judgment, as well as making reckless and impulsive decisions.
Lastly, there's bipolar mood disorder. It is a cycling between both depressed and maniac moods. It causes extreme mood swings that include emotional highs, which is the mania, and lows, which is the depression. Cyclothymic disorder is usually recognized as a similar form of bipolar mood disorder, but is a less severe form of it.
In general, mood disorders can negatively impact your daily life and can even interfere with personal relationships.
Patients suffering from mood disorders benefit from various types of psychotherapy or counseling sessions. The most common one is cognitive behavioral therapy, otherwise known as CBT. It focuses on the cognitive triangle, which is a simple diagram that depicts how our thoughts, emotions, and behaviors are all interconnected with each other and influence one another. Therefore, you can change or at least influence one by changing another. By using this analogy, CBT suggests making a 5-step guide to change our behavior. Number 1, make a list and record all the unproductive thoughts. Then create a replacement thoughts for it. Number 4, read your list out often. And lastly, notice these thoughts and replace it by the replacement thoughts on a daily basis.
However, for more severe cases, medication is also another form of treatment. The most common medication is antidepressants. One widely known antidepressant is serotonin reuptake inhibitors, also known as SSRIs, and there are also serotonin and norepinephrine reuptake inhibitors, also known as SNRIs. They both prevent the reuptake of certain neurotransmitters in the brain's nerve terminals. SSRIs block serotonin reuptake, while SNRIs stop the reuptake of both serotonin and norepinephrine. By stabilizing these neurotransmitters, it can help improve a person's mood. Another medication, known as mood stabilizers, also help regulate the mood swings that occur with bipolar disorder or other disorders. It can also be taken along with antidepressants in some cases. For mania, antipsychotic drugs are also another option, such as aripiprazole. This can also be taken with antidepressants to keep the symptoms more controlled.
For this episode, we gathered a handful of frequently asked questions and we decided to answer them.
First question, what causes mood disorders? Although there is no specific answer for this question, medical professionals believe that both biological and environmental factors may play a role. For example, if your family members have previously experienced or been diagnosed with mood disorders, your likelihood of experiencing them is still low but increased. Chemical imbalances in the brain or stressful life events or even traumatic life events may also cause mood disorders.
Can mood disorders be prevented? Receiving an early diagnosis and treatment can help reduce the severity of the disorder and can also improve the person's quality of life. A common treatment is psychotherapy, which we referred to before, or medication.
And last question, who is at risk for mood disorders? Everyone. Life events and stress can easily trigger a mood disorder, such as getting divorced, losing a loved one, financial trouble, or even getting fired from a job. These are all difficult obstacles in life. They can bring sadness or depression, or can even make these mood disorders harder to manage.
And that's it for today's episode. Thank you for listening. See you next